Hello, Pharma aspirants. I hope all you are doing well. Welcome to Pharma Syndrome YouTube channel. And in this session, I am discussing anti-diuretics. So regarding diuretics and classification of diuretics, I already posted video in our channel. So you can go there. And after that, you can listen the anti-diuretics. So diuretics are nothing but increase the elimination of fluids from the body in the form of urine. And anti-diuretics, they opposite to the diuretics. So they prevent the diuresis. Diuretics increase the diuresis, elimination of urine. Anti-diuretics decrease the elimination of urine, opposite of the diuresis. So here, one of the important example already present in the body is ADH, anti-diuretic hormone or vasopressin. The name itself that is vasopressin, also known as ADH, anti-diuretic hormone. Vaso means blood vessel, pressin means rise the pressure. So because of this action, it is called as vasopressin, and it is also called as ADH, anti-diuretic hormone, because in the kidney, the role of anti-diuretic hormone is inhibit the elimination of fluid, nothing but prevent the diuresis, anti-diuretic hormone. The hormone oppose the diuresis, elimination of urine. And here our main discussion is anti-diuretic. The drugs are substance which having action like anti-diuretic. One of the natural anti-diuretic present in the body is anti-diuretic hormone, also known as vasopressin. And here there are two types of vasopressin receptors, that is vasopressin 1 as well as vasopressin 2. And these vasopressin receptors are having different functions. For example, these vasopressin receptors may lead to increased blood pressure. When these vasopressin receptors are stimulated, they decrease the elimination of fluids from the body, nothing but decrease the diuresis, elimination of urine. And here, vasopressin analogs, the drugs shows action like vasopressin, like drugs are, first one is desmopressin, nothing but these drugs binds to the vasopressin receptors. There are two types of vasopressin receptors, all are belongs to the G protein coupled receptors. And you know, G protein coupled receptors, also known as metabotropic receptors, serpentine receptors, 7 transmembrane heptahelical receptors. So there are number of names are there. Okay. And here, first example of vasopressin agonist or ADH receptor agonist or vasopressin analog is desmopressin. The desmopressin is a selective V2 receptor agonist and more potent than the vasopressin. You know the potency, the amount of dose required by a drug to produce its action. Nothing but how much amount of a drug required to produce pharmacological action, that is potency. Next, lipressin. Lipressin acts on both V1 as well as V2 receptor. So you know lips, there are two lips. So lipressin acts on the two lips, that is two receptors, V1 as well as V2 receptors. Next, terlipressin. Next is the terlipressin. The terlipressin is a prodrug of vasopressin showing selective agonistic action on the V1 vasopressin type 1 receptor. So desmopressin, so remember D. You can remember like D2. So nothing but vasopressin type 2 receptor agonist. And lipressin acts on the two lips, nothing but two receptors. Nothing but for our remembering purpose, I am telling two lips. So vasopressin type 1 as well as vasopressin type 2. And terlipressin is the prodrug. So like this also in the competitive exams, they will ask the question. What is a prodrug from the vasopressin analogs or vasopressin receptor agonist? That is the terlipressin. And next, the continuation. So there are number of clinical applications are there. And next point is the vasopressin or ADH antagonist. Next one is the vasopressin or ADH antagonist. And regarding the clinical uses of vasopressin analogs or vasopressin agonist or ADH agonist are used in emergency control of bleeding of esophageal varices related to the GIT. Related to the GIT. So when there is a bleeding, if vasopressin analogs are used, vasopressin causing constriction of that particular place and prevent the bleeding. And even this vasopressin agonist used before abdominal radiography to expel the intestinal gas. If there is any gas in the intestine, it should be expelled during the radiography. And used in the diabetes, especially because of diabetes due to central nervous system abnormality, central diabetes insipidus. And used in the hemophilia, and used in the nocturnal enuresis also. So especially this nocturnal enuresis observed in the people generally in the age of maybe if there are problem with the diuresis, it may be observed in the people up to 10 to 15 years also, and generally observed in the old age people. So nighttime urination. To prevent that nighttime urination, ADH-like acting drugs will be useful because they prevent the urination in the nighttime. And hemophilia, especially vasopressin analogs used in the a bleeding disorder hemophilia, because when vasopressin receptors are stimulated, they promote the hemophilia. They promote the anti-hemophilic factor action, nothing but clotting factor 8. So these vasopressin analogs are using in the hemophilia because of they promote the action of the anti-hemophilic factor and prevent the hemophilia. Next, vasopressin or ADH antagonist. Vasopressin or ADH antagonist. Examples like conivaptan non-selectively blocks V1 as well as V2 receptor. Tolvaptan only blocks the V2 type 2 vasopressin receptor. So tolvaptan T under 2 TWO2. So like that you remember, tolvaptan blocks the vasopressin type 2 receptor. Conivaptan V1 as well as V2 receptor blocker. And above are the shows agonistic action on the vasopressin or ADH receptors, and below are conivaptan as well as tolvaptan blocks the vasopressin or ADH receptors. And here you can remember here antagonist, that is vasopressin antagonist. So Vaptan is nothing but vasopressin receptor antagonist. And tolvaptan also vasopressin receptor antagonist. In the examination, if you get any other drug like tolvaptan, so remember vaptan means vasopressin receptor antagonist. Especially this vasopressin receptor antagonist or anti-diuretic hormone receptor antagonist used in the syndrome of inappropriate anti-diuretic hormone secretion. Syndrome of inappropriate anti-diuretic hormone secretion, where there is a abnormality in the secretion of ADH, anti-diuretic hormone. So you know, anti-diuretic hormone or vasopressin released from the posterior pituitary like oxytocin. So this is our session. Thank you.